Pedro. It's my great pleasure being here to accept this kind invitation from Dr. Sharma and Dr. Kinney. And my task is to share with you how can we improve patient care. This is the word. This is my conflicts. And I used to start with the Singularity Concept that we are moving from digital to the biodigital fusion. The way digital is moving fast, exponentially, will have emerged within brains and computers. And how is that happen? How is that happening in our current era? Number one, because of the fast speed internet. The way internet is moving fast is changing the world. And more than that, the wide availability. If you go throughout the continents, 55% of population, the whole population is connected. In the US, is almost 90% of people uploading and downloading data every day. Then you come to a big data scenario. The next more important variable to change our world, number one was the internet speed. Number two is the computer capacity. Since 1965, Moore predicted that computer capacity would double every 2 years. And it's that way since 1965. Moving this way, we come to the three most important features to change our practice, to change our life. Number one is the computer capacity. Number two, big data. Number three, uploading this data in a fast speed to the cloud. These three components generated the artificial intelligence environment. And if we add that to telemedicine, we completely change our practice. And we get to this exponential growth of knowledge. Within the next 30 years, one computer will process more than the whole human brains in the world. It's predicted. I hope we can reach that point. And then we come to the 6D of exponential technology from the amazing book, Abundance. And it's an abundance of information, abundance of opportunity, abundance of chance to treat people. And we have digitize, disruptive, demonetize, dematerialize, and democratize. Let me come to one very important topic. We have we tend to use the reverse anthropomorphic thinking. But it's not this. Computers are not thinking the way we think. If we show you this image, you think that they are stones. But the computer, if you submit them to non-supervised deep learning, they will tell you more than that. Computers will tell you what are they made of. Calcium oxalate, whatever. This is the first message I want to share with the physicians. Don't think the computers will think the way we did up to now. It's completely different. It's the opposite. It's the reverse of anthropomorphic thinking. And this is another amazing example. People from cardiac try to correlate T-wave with potassium level. They fail. But when they submit the raw EKG data to the computer and just ask the computer what happens, then they came with the data and they said, yes, you can dematerialize the EKG and it become a blood test. This is the main message, that artificial intelligence will completely change our way of thinking. But life hasn't been that easy so far. We have a lot of barriers: reimbursement, licensing, cost of technology, reliability in privacy, and cybersecurity. But in the same way, the way to improve is to invite technology. And blockchain has been an amazing technology. We've been using blockchain to anonymize and to face this challenge. Now, let me answer your question. How can we help improve patient care? This is the patient centricity. What will be the smart hospital of the future, but is the smart hospital like this Mount Sinai in New York? This is a smart hospital, because you can do remote registration, web checking of the patient, remote consultation, remote diagnosis, and remote treatment. This is the way we can help these patients. One approach is to offer the patient access to algorithms. and then these algorithms will select the patient, triage the patient to the health system. This is one example we just saw this morning in the Apple Heart study, and Dr. Samir Mehta, together with our team, started an algorithm to detect STEMI with a single lead EKG. Number two, patient goes to the health system, and the health system uses the algorithm to return back to patient. This is the Latin Dr. Samir just presented. Patient comes to the emergency department, they send the EKG to the cloud, and now the algorithm augmented our system support decision, and we help treating patients. So far, as of yesterday, we transmitted 800,000 patients, 8,000 STEMI, 4,000 treated. We reduced mortality by 50%. And another way, patients go to doctors. Doctors use the algorithm, and this algorithm will help doctors treat the patients. This is the teleconsultation. It changed my life. I can't live without this. And finally, doctors to doctors. This hospital is very familiar with this. This is an example of Telecore Lab. This is my cat lab in Uber land. We can connect to Alex Abzaid Core Lab in São Paulo and help people. This is the way I hope to be connected to Dr. Sharma to treat complex patients with rotablator. And finally, the last word is the real-world evidence that comes out of this amazing environment. That smart hospital is a center of excellence and collects data from the EMR, collects data from the medical claims, collects data from wearables, apps, and whatever, as we saw this morning, and from pharma records. Of course, we check the setting where we collect the data, we check the methodological approach, but we expand this network to an amazing, unexpected size, and this is the magic word, computable phenotypes. Computable phenotypes is the way to teach the EMR to help us with structured data from unstructured data. What is this? Computer language. And this is an example, the adaptable trial for testing aspirin, and we can help answering the question you posed today. And my last slide is the conclusion that we come to a very virtuous cycle, that from the e-health, it's all this, we improve guideline adherence, physician shortcut, capillarity, scalability, all the AI, cognitive computing, Internet of Things, we improve efficiency, we improve outcomes that then improve country income and life expectancy. The challenge is to exchange the physical dimension to the time dimension. There is no time to waste. Let's move fast to be back next year with better news to you. Thank you so much.